Why is humidification advised with the use of nasal CPAP? In my patients, I always advise that they use a humidifier along with nasal CPAP. The nose is your body's natural humidifier. With nasal CPAP, air is blown into the upper airway at a very high flow rate, which makes it impossible for your nose to adequately humidify your air. The air then dries out the lining of the nose. The nose lining consists of millions of hair-like structures which are constantly beating and brushing away bacteria and dirt and dust from the upper airway. If your nasal mucosa is dried out because you're not adequately humidifying the air, the cilia or hair-like structures fail to beat adequately, increasing the risk of infection and increased allergy symptoms. Humidification is vital for both comfort and nasal hygiene. I'm Dr. Ronald Popper, Medical Director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. To view more videos to help address all of your questions about sleep apnea and other sleep disorders, please view our website at sleepmd4u.com. Thank you for watching, and always remember, sleep well tonight for a better day tomorrow.